everyone and my fellow classmates. This is House of Samson, and today we will share information and talk about the important facts as well as how to properly perform CPR. CPR stands for cardiopulmonary resuscitation. It is a life-saving technique used in an emergency when the heart stops beating. Immediate CPR can increase a person's chances of survival after a cardiac arrest. It can maintain an active flow of oxygen-rich blood to the brain and other organs until emergency medical treatment can restore a normal heart rhythm. Doctor's ABC stands for Danger Response Send Airway Breathing CPR. It is a set of steps that will guide someone through the first aid procedures that explain the steps that a first aid provider should work when encountering a sick or injured person. Knowing how to respond in the doctor's ABC manner allows you to assist a person in breathing, reducing pain, or surviving until an ambulance arrives.
The first acronym of Dr. ABCD, which stands for danger. Always check the danger to you, any bystanders, and then the injured or ill person. Make sure you do not put yourself in danger when going to the assistance of another person. Second is R, which stands for response. It's not only about the first aid reaction, it's also about the casualty's ability to respond and offer information about their status. If there are other people present, the third step will be to call for assistance. If there are other people present, tell one of them during an ambulance ride. If no one is around to assist you, yell as loudly as you can for assistance.
Open the airway using the head tilt chin lift maneuver. Pinch the nose to your shot for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. Give the first rescue breath, lasting 1 second, and watch to see if the chest rises. If it rises, give the second breath. To check if a person is still breathing, look to see if their chest is rising and falling. Listen over their mouth and nose for breathing sounds. Feel their breath against your cheek for 10 seconds. And if they're breathing normally, place them in the recovery position so their airway remains clear of obstructions, and continue to monitor normal breathing.
Disability assessment, deadly bleeding, or automated external defibrillator, AED, which is a device that shocks the heart so it begins beating. Examination, evaluating the person for signs of injury, bleeding, allergies, or other problems once you know they are breathing and their heart is beating.
Avulsion, also known as a skin tear. An avulsion is a deep break to the skin, tearing it away from the underlying tissue. Wounds of this type are usually more serious and extensive. Traffic accidents and machine injuries are among the common causes of skin avulsions. The first step is wash your hands. Cleaning a wound with dirty hands increases the risk of infection. Even if your hands appear clean, before doing anything to wound, wash your hands thoroughly with soap. Rub your hands under water for at least 20 seconds and use soap to remove germs and bacteria that may cause infection in a wound. The next step is to stop bleeding from the wound. You should do this by applying pressure to the wound and allow the blood to clot. Make sure to use a clean cloth or bandage when applying pressure to the wound. Once the bleeding stops, it's best to clean the wound with running water. Be gentle while you clean it. You may notice a stinging sensation, pain, and some slight bleeding when you clean it. This is normal. Next, apply an antibiotic ointment to the wound. This antibiotic will prevent the growth of bacteria that may lead to an infection. A thin layer of bacterial antibiotic ointment is enough. The last is cover the wound. Use sterile dressing to cover the wound. The goal is to protect the wound from outside elements as it heals. If the wound is minor, you don't have to cover it with sterile dressing, and a simple bandage will do. However, for moderate-sized wounds, it's best to cover it with sterile dressing and tape. Burns are caused by overexposure to thermal, electrical, radiation, laser, or chemical agents. You can treat minor burns at home, but a non-minor burn would require immediate medical attention. Cool the burn. Hold the area under cool or not too cold damp of cloth with ice on it to help minimize the redness and to cool down the said area. You can also remove the unnecessary items from the burned area. Try to do this quickly and gently. Bandage the burn. Cover the burn with a clean bandage. Wrap it loosely to avoid putting pressure on burned skin.
This video will show you how to apply first aid to a puncture wound. Before you examine the puncture wound, you need to wash your hands first to help prevent infection from entering the wound. Then apply gentle pressure with a clean bandage or cloth onto your wound to control or stop the bleeding without the removal of the object. Once the bleeding has been controlled, wash the wound with clean, warm water for 5 to 10 minutes. If the dirt or debris remains into the wound, use a washcloth to gently scrub it off. Here, I can remove the object piercing my wound, as it is just a light prick, and then I just clean the excess blood off my skin. After that, apply a thin layer of an antibiotic cream or ointment such as Neosporin or Polysporin. Finally, cover the wound properly. This bandage helps keep the wound clean. Reminder: watch for signs of infection. See a doctor if the wound isn't healing or you notice any increasing pain, pus, swelling, or fever. On light skin, spreading redness is a sign of infection. On dark skin, redness may not be apparent, or the infection's streaks may look purplish gray or darker than your normal skin.
So, ito yung laceration. Ito yung naging cause ng open wounds, kaya nagkaroon siya ng ganito. So, first, ang ginawa muna namin is hinugasan muna namin yung wound, pati yung kamay ko para safe. So, first, ang gagawin natin is apply the pressure on it. Then next, pag nagkaroon na siya pag medyo okay na siya, tanggalin ulit natin at lagyan natin ng gamot para maging malinis yung ano natin. So next, pagkatapos nito, lagyan na natin siya ng bandage para kailangan malinis to para maging safe at saka walang magkaroon ng cause ng bacteria. Then talian na natin. Then apply it every 12 hours para mas safe yung mangyari.